Yo, so I'm sitting here editing this video, right? And I sound like Mike Tyson, bruv. I don't know what it is, but yeah, so excuse Alex sounds fine. I don't. I sound like Mike Tyson taking shrooms, bruv. But anyway, it's true though, isn't it? But anyway, enjoy the program. Yo, everyone, welcome back to the channel. Ed Talks About. I'm Ed, and today I've got a special guest with me. He is a medical cannabis patient. He's expert and advocate, and he's also an access lead. My bad.
Patient access leads. Don't worry, you're all right. Everyone gets that wrong. Everyone gets that wrong.
Patient access lead at Grow Farmer. He
Correct.
is Alex Fraser. How you doing, mate?
I'm very good. Thank you for having me on the show, Eddie, as well. I really appreciate your
My
time.
It's my
I
pleasure, mate.
love the show. Love the show, man. I've been watching you for a while since you started, and I'm a fan. I'm a real fan.
Oh, I'm a fan of you too. That's why I wanted to get you on the show, mate. So
Oh,
there you go.
that's very
Right.
sweet.
So let's dive right into it. Alex Fraser, let's see a little bit of your background.
Yeah, no worries.
Why do you use cannabis?
I'll give you the full spiel, shall I? I'll give you the whole story. I'll
Yeah.
try not to make the whole thing last the whole podcast episode. It's a little bit of a long story, but right. So yeah, I mean, I was a cannabis user when I was a teenager. I think I probably started using cannabis when I was 17, so later than some, but relatively young. And back then I was a healthy young lad, nothing wrong with me at all. So it was just sneaking around the back of school, to be honest with you, after class and having a cheeky smoke. And that was, my teenage years, and never really thought more of it, other than I suppose, I think what everyone experiences was you've tried cannabis for the first time, you go, everyone told me I'd lose my mind and I'd go flippy and it would all be terrible. And I'm actually it's milder than having a pint, so I don't quite understand how. And all the laws start. You go, why is this illegal? But anyway, apart from that, that sort of realization all happened very young. But
The questioning started.
it does,
Yeah.
it does. Why has someone told me this thing that's really fun? Is yeah. Anyway, shouldn't be doing this either. It's like I say, don't smoke anymore. It's all medical now. But then I'll tell you how I got there, I suppose. But when I was 19, I went to university down in Brighton. And at the end of that first year of uni, I got really, really unwell. It took about 3 months to get a diagnosis, but before that even happened, I realised that what I was using quite casually, just for parties and things like that, was making a massive difference, an absolute massive difference to my life, to the symptoms that I was experiencing, even before I knew what was wrong with me. So it was a lot of vomiting, it was a lot of going to the toilet. I thought I had food poisoning first. First thought I had was food poisoning because it was extreme, and it just immediately I was like, okay, there's something going on here that's very important. And it went back to my parents' house. I was so unwell. I went back to my mum's that summer because it just wasn't well enough to look after myself. But even there, I was sneaking out and meeting friends and saying, look, I really need this. And it became something that I didn't even know what I was doing, didn't really understand what I was doing, because I knew I wasn't a drug addict. I knew it wasn't something like before it being ill, I didn't need cannabis. There was no, oh, I have to sneak out and have a toke. I must do that. It was very casual. But even before I had a diagnosis or knew anything that was wrong with me, yeah, I was sneaking out because it was just relieving my nausea, stopping me from vomiting, helping me keep food down. Honestly, I don't know if it could have saved my life then. I honestly don't know what would have happened to me if I hadn't had cannabis at that moment in time. The thought scares me, honestly. Or if my mum had been stricter about it, I think she was quite aware of I was probably sneaking out and she probably knew what I was doing. If she'd been stricter about it, what would have happened? Long story short, I got diagnosed with Crohn's disease that summer, and at that point, the beauty of getting a diagnosis is you can talk to people online and you can research the disease and you can get to know ultimately what you're in for, which is terrifying, because you're like, oh great, I've got a lifelong disease, it's an immune disorder, there's no cure, there's all these different treatments I've got to think about. It's a very painful, horrible disease, and there's not good painkillers. That's one of the things that becomes very immediately aware. And basically what I did, I mean, I went online and found loads of Americans and people in Canada and places like that who were using cannabis, and everything that I'd sort of been experiencing up to that point was validated. I was like, oh, so this isn't just something that I was randomly experiencing. This is something that actually over the Atlantic, hundreds of people are using the thing that I was just casually using for the disease that I now have. So I'm very lucky, very lucky.
Yeah, no, I do understand. My wife has Crohn's as well.
She really?
Yeah, I can understand. I mean,
before she was diagnosed, there was a lot of morphine involved,
Mm.
you know, and I can see it's a slippery slope. I mean, for me, the better alternative would have been what you happened to you, like, you know, that found cannabis and realised 1 and 1 makes 2, you know.
Mm-hmm.
So
I was so angry about it, though. I was so angry that the doctors couldn't give me anything that was better than what I was getting on the street. That was absurd to me. I just could not, for a long time, you know, talking years, there were like at least 18 months, I was really just angry about that fact that they wouldn't really give me painkillers because they don't really help. Opiates aren't good for you long term for Crohn's. And they're
no.
actually, my doctor was like, better not even start down that road. You know, come back to me when things are really unbearable and we can have a chat. Not that they were unbearable already, but God, yeah. And then I was angry because the doctor, the gastroenterologist I had at the time, the bowel doctor, for those who don't know, it's was very skeptical about cannabis and didn't buy into what I said. He was quite scathing about me as well in places. I was not a doctor. I wouldn't name him or anything, but he was not a doctor I would recommend. I had long hair at the time, and he sort of made jokes about that. And I'm like, this is inappropriate. I'm suffering, and you're meant to be helping, and you're sort of poking fun at my appearance and the fact that I use cannabis. And this was all lumped together. This idea of
Stereotype, yeah.
yeah,
I mean,
it
my
was
wife
that
had the
stigma.
same. She had the same thing with her gastro, because she wasn't using it at that moment, but I was, and I was in the appointment with her, and
Mm-hmm.
I smelt of it, and the doctor, she leant forward. She said, "You do know cannabis is very bad for Crohn's, don't you?" And inside, because I'd done all this research, I knew anyway. But inside, I was heaving but I didn't at the time. I didn't know how to put my point across without being angry. You know, like there's a point where, you know, when you're quite angry, that the injustice, you know, like, and now I would able to sit there and just explain the situation. Now I'd be able to do that now, but at that time I wasn't in the frame of mind, you know. But it was shocking, and she said the smell of cannabis makes you sick, you know, and you can lose a lot of weight and all. And I'm like, where is this coming from? I
Yeah,
wouldn't name her either, but yeah.
yeah. It's scary, isn't it? And we still have that to this day. I still talk to patients who tell me like, "Oh, the doctor says this is not going to help. This is really bad for me." And you've got on the other side, we've got doctors who are again, I won't name them, but the doctors who are prescribing this stuff who are like, "This is a lifesaver for this disease or that disease and this thing," and they're obviously committed to it as part of their careers now. So,
Yeah,
um, but
I mean,
the anger was a good thing because the anger led me to getting involved in campaigning and talking to other people who were equally angry and equally upset. Um, and I met like-minded patients. Actually, we at the first ever, I think it was the first ever Green Pride in Brighton, which was
oh, right.
about 25 people in a park. Literally, at that point, it was very small. Must have been about 2013, 2014. It must have been 2014, around April.
Oh,
In
nearly
fact, it
10
might have
years
been.
ago.
Yeah, literally 10 years ago. 10 years ago, and I
Yeah.
started actually meeting other patients in person and having this conversation because a friend of mine knew a friend who had multiple sclerosis. That turned out to be Clark French, who you might know is
Yeah,
you know,
yeah.
one of the early stage campaigners in this, still around.
Hmm.
And me and Clark and a few other patients just went, "Look, we've had enough. We're going to set up this organization and we're going to campaign against this." And that, you know, that was already underway. I think Clark already had a lot of the plans, but I think my contribution to that was the real in-person events. I think that was where I really sort of came into my own as a campaigner. I wasn't always the best person to put in front of media. I wasn't always the best person to organize, um, political campaigns and
Yeah,
online campaigns,
yeah.
but I was good at events management. I'd done events management as part of my degree course. The degree was in music, so I'd done events management, which was like
Oh,
gigs,
right.
and
Yeah, yeah.
promotions. I actually had a small promotions company in Brighton at the time that I was running ska and punk gigs through, which was great fun. But
So that helped.
and yeah, so that knowledge of knowing, you know, how to negotiate and book a venue, understanding what, you know, disabled people need is in terms of accessibility, how to, you know, run a sort of lineup. Even, you know, lineup of bands is not dissimilar to a lineup of speakers at an event. You have to know who's going to follow who, what's going to make sense, how that's going to land with an audience, and what the audience is going to get from the end of that meeting. And that was, for me, the most important thing I did for advocacy was booking out like local town halls across the UK and just inviting expert patients. Sometimes the local politicians would come along and speak. Um, and we just have a little sort of community event with, you know, in Brighton it was quite a big one. I think it was 150 people in the audience. In other parts of the country, we did one in Maidstone. I think there were about 30, 40 people. So very small ones. Did one in Bournemouth, where I took a suitcase on a train from Brighton full of T-shirts and pamphlets and leaflets. And we were in a back garden of a cafe where the owner of the cafe was very pro-cannabis and he invited us to come to a talk. There was about 20 people. But some of those 20 people now are really good friends and people who are still involved in the space and patients who I speak to via clinics and pharmacies and things like that. So it was a special time. It was a really difficult, strange thing to be doing. And I don't think we ever knew that we were going to succeed. When in 2014, 2015, definitely not. Later on, it got a bit more momentum. We did more mainstream TV. And you know, it started to look more positive as a campaign. But even then, I don't think we knew we were going to win, we were going to get a law change, and that we'd end up where we are now. And it's crazy to think back. It's crazy looking back at it now.
You think about it, it changed in 2018 to, if anyone's watching, the UK changed in 2018. Was it the 1st of November?
That was correct. Yeah, that was when the law change happened. Yeah.
Yeah, and so could you imagine when you in 2014, your mindset, you wouldn't if someone said to you in 4 years' time.
Yeah, just 4 years.
Yeah,
just keep doing this for 4 years. It'll all be fine.
I know. Could you imagine? Like, you know,
we'd have been ecstatic to hear that. We'd have been so chuffed. And then to say, oh, look, 5 years later, we've got a market and there's roughly 70 flowers. There's all these oils. There's lots of THC. The doctors are happy to prescribe the THC. I thought that would be a huge problem. When I was campaigning, I never assumed it would have flowers on prescription. You know, part of me thought that would just never be an option because
just oil.
Yeah, oils, cartridges. I mean, inhaled is important. When we did do, I was sort of skipping a bit. I guess I'll tell you a bit more about the campaigning first, but I'll get to the point I was going to make, which is talking about inhaled medicines, and why they're important. But so yeah, 2017, 2018, things started to get higher profile. I was asked to do ITV, Good Morning Britain, and that was for me the most profile TV spot I've ever done. In fact, which was insane. Oh mate, the scariest thing I've ever done. You get up at 5 a.m. They send you a cab. Staying at my dad's in South London. Cab picks me up, takes me into central London, the ITV studios, makeup on. It's like 6 a.m. Obviously, with the chronic disease, I'm not getting up like early anyway. So this is I'm like, I might as well not.
It put you into a little spin, didn't it? You know,
I was all over the place.
Yeah,
all over the place.
Yeah,
I'll tell you an interesting story about what happened as well. But I did that piece. And I was on the chair, and you can see the clip online. If you search my name, ITV Cannabis, you'll get the clip on. I think it's on Vimeo, on the Grow account. And as soon as I came off, there's so much adrenaline when I came off. Went back to makeup, and they're taking makeup off, and they're just debriefing and all that stuff. And one of the makeup artists said some stupid thing. They said, somebody I know was run over by someone on cannabis, or someone took some cannabis and then cracked their skull in, or there was some horror story that they'd internalized. And I proper went off. Like, I won't say exactly what I said, but I was like, it was the adrenaline from being on TV. I was hyped up, and then hearing that someone say that in the back of my ear, I was like, I'm here to, because that's the problem. That's the problem.
You are the problem. Yeah.
Yeah. Sitting here in the green room and behind the scenes. So it's just interesting that you don't, even when you're there to normalize this and to be talking about this, the stigma is everywhere around you still. It like I say, looking back, it did feel like walking through the valley of death. It felt like everyone was against us. Politicians weren't supportive. The general public. I was talking about my mom earlier. She was also quite scared about the high profile of, going on ITV and saying I use cannabis every day when it was illegal, which is what I did.
Yeah.
It could have gone very badly for me, really. I'm very lucky that led to a career in other things. The point I was going to make about inhaled medicines was the most high profile thing I did in terms of politicians is we went and met Nick Clegg when he was Deputy Prime Minister. Which was interesting. Obviously, at the time, this was before some more of the controversy, the whole thing with the university fees, all of that stuff. So he was quite well respected and quite liked generally on the sort of left wing of politics. And he was very open-minded. And we met him in the Houses of Parliament. He booked a room for us, and we took a delegation of about 7 or 8 patients in to talk to him about our experiences, about the campaign. And he was very open-minded.
Yeah.
And the part of that I remember is explaining to him what dabs were, sitting in Parliament with Nick Clegg and explaining what dabs are to people.
No, it's not that.
Yeah, exactly. I don't even think that was a thing yet. I don't think that happened
I
yet.
know.
This is so far back. The only dabs. He didn't know what dabs were. He'd never heard of
Yeah.
anything of the sort. And you make the point to me, like, look, pharmaceutical medicines are concentrated, and also an inhaled mode is really important. So you need a concentration is a good thing for pharma meds because you're dosing them properly. It shouldn't matter that they're concentrated, as long as you can dose them.
Exactly.
It's easier to get a large amount of THC in your body without having to puff away. I'm on flowers now because my dosing is a lot lower. I'm a lot less sick than I was. Flowers are fine for me, but when I was really, really ill, and it was back then, there was nothing legal anyway. The most potent thing was what I wanted, with the most minimal effort, minimal grinding, inhaling, filling. Don't want to inhale all this plant matter. I just want THC into my body to help me manage these symptoms. And the inhaled mode is so important because it does exactly that. It's fast. And you can take it as and when you need it. And it doesn't last all day. My symptoms don't last all day. I eat food, causes irritation, nausea. I manage that with my cannabis, and then the symptoms fade, the cannabis fades, and I get on with my day. I don't have to be on cannabis every minute of every day. And inhaled actually means you can avoid that. People often think, oh, inhaled is like, it's more recreational, or you're trying to get stoned, or there's sort of more to it that's sort of non-medical. And the reality is, it's a lot of people use the inhaled mode because actually they don't want to be medicated all day, every day. They want to be able to just have a puff and have relief for a couple of hours.
That's the thing with oils. You can take the oil, especially if it's your first time taking a specific oil. You could take a dose, and then that could knock you out for a couple of hours, or if not longer. And but with the vaping, you can. Like before, I've got degenerative discs. So when I vape, I'm like, that's not enough. I can vape a bit more. I go, that's enough. And I know my limit. But with the oil, I find do I want to be like this for the whole day? Maybe at night time, that's totally different. That's totally different. But in the daytime, I can see why the flower is a lot more preferable to a lot of people.
And for newcomers as well, I say this to everyone who's never tried cannabis before. This be a good clip for your socials. Everyone, if you've never tried cannabis before, do not eat it. Do not go to Amsterdam and get a brownie. It seems to be the thing that's in everyone's mind is, I don't want to smoke. Smoking's gross. I will go to Amsterdam. I'll eat it. I like eating things. I like brownies. I'll eat a bit of a brownie and it'll be fine. No. And it doesn't go well. It rarely goes well because no one knows their tolerance if they haven't started. You eat a brownie, you don't know. Nothing does nothing for 45 minutes, sometimes longer. Often people eat a second one before it's done anything. Yeah, exactly. And then you're in that state for what, 8 hours, 10 hours of very stoned, very sedative effects that you get from eating it. I know this is way off with medical here, but
but people don't realize that when you eat it, it has a totally different path through your body, and it changes from delta 9 to, I can't remember off the top of my head right now.
11 hydroxy.
11
hydroxy THC. Yeah,
I was about to say 11. Yeah, so that's exactly right. So, and that's a lot more potent than delta 9 THC inhaled.
A lot more psychoactive. That's the important. The important thing is there's less of it in your body, but because it's so potent, you get a stronger effect. And what that means is a high level of psychoactivity of the stoned and a low level of medical effect. And there's a caveat to that actually the psychoactivity is the medical effect for some people, particularly anxiety, depression, particularly people looking for some sort of sedation. So it's a grey area, but generally, and then you tell obviously these if someone's new to cannabis, you're like, look, you don't have to smoke it. There's these lovely vaporizers, there's cartridge vaporizers, all sorts of things you can do. And you can have half a lungful. You can have a sip, literally a sip, and then put it down and see how that affects you. That level of control is not possible in any other way, in any other sort of ingestion method, oils, anything else. So it's important that the general public, I think, understand why inhalation is such an important part of this. And if you could get, I'm sure it's not impossible to do, but I suppose you could do inhaled opiates and inhaled other drugs. We do asthma medications, of course.
I suppose. I mean, what was opium?
Yeah, it's true. You smoked it, didn't you? I suppose so. It potentially could be done. Maybe there's a later down the line in pharma. Maybe if we license like a cartridge vaporizer for THC on the NHS, you license it and you get that approved, then and for something like chronic pain, then we can go back and reinvestigate an inhaled mode of an opiate and do a similar thing where you put morphine into a similar position. I when I'm saying it out loud, I'm thinking, well, potentially dangerous, potential for people to just suck away on one of those things
Always
until
going
it's
to be
a problem.
abuse. There's always going to be abuse, though, isn't
True,
there? No matter,
true.
even with pharmacists. Look at America, for instance, with the Xanax. This has been Xanax,
Yes,
for
yeah.
instance. Yeah,
Mm-hmm.
and so I mean, there's always room for. There's always going to be an abusive person out there that's going to do it. So, but I can understand. I can understand. Imagine if you was in a car crash and you or something. I believe the injection or morphine is definitely the way forward. You know, like I've
I
always
suppose that's
believed
it.
that.
Yeah, they
I've
inject it.
always
I suppose that's the answer, isn't it? Is that actually they're if there's a route to administering a medicine that's actually better, more effective than inhaling it quicker, it's injecting it. And we don't,
thing.
I suppose we haven't done the reverse. It's not that you'll get opiates that will become inhaled. It's that what we're probably going to get later down the line is some sort of IV cannabinoid, which
Cannibal,
they put a little
exactly.
drip in.
Now, prohibition has stopped the evolution of that. I mean,
Exactly.
we could have been decades in advance of where we are now. I mean, you could instead of a morphine injection, it could be a cannabinoid injection, bang,
Yeah.
and
Yeah.
it would do the same thing. It's just that we've been held back, you
Yeah.
know. So
Exactly that.
yeah,
We've not been able to do the R&D. We've not been able to do the doctor education. We've not been able to normalize this as a medicine and get healthcare professionals and hospitals on board with it. And that is a perfect segue into what I do now for a living, because it's exactly that. And I'm very, very lucky, I suppose, to finish that narrative, finish my little sort of story is I left the United Patients Alliance over the summer of 2018. I think we knew the law change was coming by then. We knew the campaigns with young epilepsy children, which I played a very small role in. I was sort of behind the scenes for some of those events, helping organize and manage and doing some of the networking, whilst those parents did all the important work of being in front of the camera and telling their story and talking to politicians. So as you know, we supported that. As the UPA, we sort of decided, this campaign is going to be focused on these children. They're not part of our organization, and actually doesn't really help us or them to do that and link that up. They need to do their own thing. We'll step back into the background, and the adult patients will support with the stuff in the background whilst this campaign is ongoing. And it was the right thing to do. And we owe those parents, everything really at this point. So I left the UPA towards the end of that summer after those campaigns. Really, we knew the law change was happening, and between us, I think some of the relationships between some of the people in the organization were strained. It was time to move on. I get accused now of being cynical, of being like, you knew the law change was coming, you went straight for, you were campaigning to get yourself a job. And like I say earlier, we had no idea that, that anything was going to happen in 2018 at the beginning of that year. No idea. And the other reality, obviously things look great in retrospect. The whole narrative of someone's career makes a lot of sense. But the reality is what happened then was I sort of set out to work for myself and did that for about 8 or 9 months. And that was the hardest graft I've done in my entire life. That was leaving an established organization where I'd made a name for myself, trying to carve out something that I could make a living from. There were like monthly networking events in London. And I get the train from Brighton up and get the train back down again after a few beers, much more inebriated on the way back, but usually with lots of business cards in hand. There you go. Look, there's a whole pile of them from that era that I was looking through the other day. In fact, all sorts of old business cards of companies. Some are still around, some aren't. But and I'd call these people up, and I'd get maybe CBD companies, or there'd be medical companies looking at the space. There'd be sometimes there were politicians, and I got asked to do some work. I got flown out to Guernsey to talk to their politicians at one point, and just sort of tried to make a way out of this. And I really did not have any plan for tying myself to one company or doing anything of the sort. It was just a sort of, let's see where this goes. If I work really hard, and how long can I maintain this as well, I suppose? How long can I keep that money rolling in and keep myself supported? And still I actually had a 0 hours job in Brighton already, I should point out. Like, it wasn't my only income. I was working in a public library, which is it's a great job, but it's not a well-paying or particularly full-time or anything like that. No holiday leave, 0 hours, everyone knows what so in January, I suppose it happened in sort of December, January 2018, 2019, at one of those networking events, a very early stage employee for Grow, bumped into me and said, actually, recommended we talk to you by the guy who organised the networking event, Alistair Moore. Actually, I should name Alistair Moore because, again, owe him an awful lot. He is doing all sorts of wonderful and interesting work now but at the time he was working with Hanway Associates, and the networking event was called First Wednesdays, which was him and a group of guys that were just inviting cannabis companies to London to network and chatting. And it was amazing to begin with, and it very soon became very corporate. But the early events were, I look back at that now and they're like 10, 20, maybe 30 people in those rooms that have all now gone on to be some of the most influential people in this space. And you look back at it now and think, oh, it was Ed McDermott who eventually sold EMAC to Curaleaf, which is the whole Sapphire vertical. He's no longer around, but he was obviously a big part of things. There's so many fantastic people. The guys that became Life Group, the guys that obviously became Integro and Grow were there. And it was looking back now, it was very exciting, and it's COVID sort of put a stamp on that and stopped all that, and it's not the same exciting new industry that was just literally coming out of nowhere.
COVID sort of helped.
Boring.
COVID sort of helped the video call side, though, didn't it? It actually it pushed us in that direction. So, because I remember before, there's a clinic and you've got to travel all the way. It was. That's why I never got cannabis until it was like during COVID. Because it was like, wow, okay, I can just do a video chat, so it makes it a lot more accessible, doesn't it? Like.
Yeah, exactly that. Exactly. The early days were really, really hard. The doctors were really skeptical. There were a handful that were dying for this to happen. Often those who were working in cancer, particularly, and some of the pain specialists, I think, really were keen for this to happen. But the prices were the cost of medicines was very high. Because there was such a small number of patients. We were setting up a whole supply. We literally did the first import of Valentine's Day 2019, and we. At that point, obviously, we knew that we were investing, but we'd set up an entire supply chain, international supply chain, with the highest licenses, the most difficult to get, strictest licenses you can get in medicine, and we'd done an import, and that was for 4 patients. So
wow.
And we called it the first bulk import, but it was 4 patients. It was maybe 200-300 grams, I imagine, probably a bit extra, but yeah.
And that was
extortionate. So expensive.
It really was, wasn't it? Like, I mean, now it's. I find, to be honest, I know people go, oh, I see it on all the Facebook pages, and they're all like, compared to the black market, it's so much more expensive. You get charged this, you get charged that. But if you just add it up, I've done a video on it. If you add it up, it's probably cheaper in some aspect. If you can afford the cheap stuff, you can get that. Like I've got a video coming out. It's like I've got the really cheap stuff and I've got an expensive stuff to just show you if this is what you can afford. If you can't afford that, this is going to get this. So. But I do. It bugs me a little bit. And the new one that's been coming out is medical cannabis isn't as strong as black market cannabis.
Yeah, that's odd. I don't quite know where that's coming from.
Where did that come from? I don't understand that one.
Yeah, I have a few people that I've spoken to recently who've been saying that. I don't. You have to. I suppose there's a level of skepticism. I think when you're talking to someone online that you can't see, or they're behind a profile picture, you don't know who they are.
No.
It's sort of, what is their motive? What's their agenda? You have no idea. But you have to listen. For me to do my job properly, I have to listen to patients and what they're experiencing, and I cannot work out why people would think that is the case, because it's just not true at all. In fact, my experience is quite the opposite way around. In fact, I did a poll on Facebook quite recently, and it was it's either as stronger, less strong, or it depends on product, versus illegal and black market. And no one said illicit was stronger. It was, I think, 25% said medical is stronger, and everyone else was like, it depends on the product. Of course it does. It depends if you get a strong flower. On the black market, on the legal route, it can. I think the important caveat, the important thing to say is, if you get a prescription, it can be milder. It can be a balanced ratio. It can be low THC. It can be a CBD flower, all the way up to you can do any ratio of oil, THC, CBD. So it's about having the option, and it does go up to 29-30% with the flowers. I'm surprised it's as strong as it is.
I mean, and they're quite strict on their testing, aren't they? It's not like California where they're like what is it, 10%? Yeah, 10% or so. So they're allowed to claim 35% or 40%. So they're allowed to claim that.
I don't know how they test either. We get So we get product that's available in Canada and it's tested in Canada and we get the results in Canada, and then we bring it to Europe and we test it here, and the results are always a little bit lower. And either they're just playing the numbers a little bit in Canada.
Yeah.
I don't want to make accusations. I'm not saying they're doing any of this stuff, but or they're just, the tests aren't as accurate and they've got a level of disparity and they're just saying what's at the top of that level. I don't know, but it's definitely not weaker. It's definitely, I think it's all about finding the right product and the right strain for you.
That's right.
And people will, I think there's also an element of moving away from smoking to vaping. That will change the effects a little bit. Yeah, I don't know where that comes from. But regards to the cost as well, the cost thing. Again, I'm going to talk about a poll that no one who's watching this can probably access. But the Cannabis Industry Council did a whole survey of, I can't remember how many patients, but it was in the thousands, prescription patients. And it's not been published yet, but I think they're planning to. But one of the results, and you have to take my word for it, was just, do you save money now you have a prescription? And more people said they save money now they have a prescription than said that black market was cheaper. So I think there will be people for whom a prescription is more cost, more effort, and that is just a fact that we have to accept. But I think a lot of people in the UK that don't have good access, there's a big silent majority in cannabis where the people who are geeky about it commit to it. They make it becomes part of their identity, and that's not a criticism, that's just a fact. And as a result of that, they get good contacts eventually. And there's everybody else that's sort of not in that world that just wants to access it or get something that helps them. And in the black market often takes advantage of them, and it's not good. And I think we hear from the people who have a good experience, because why would you go on the internet and say, I bought some illegal drugs and I got scammed and I spent loads? Why would you? No one's going to brag that. The internet's all about talking up the good stuff and hiding the bad stuff of your life. Well, if you pay over the odds for some illegal cannabis, you're never going to go online and talk about it, because there's a whole shame involved in it. So you only hear from people who are getting a good deal and mates rates and the best of the illegal side of things. You don't hear from people who are having a bad time. But
it's always my weed's better than yours. That's the sort of mentality, isn't it?
There's a lot of that, isn't there?
Yeah. I mean, but Vera down the road, for instance, just a random person, she can't go and walk on the street if she's got arthritis. She can get it delivered to her door safely and not have to deal with any gang activity. That's the problem. It's the activities that go along with it. Cannabis itself is not harmful. I mean, obviously the way it grows in an environment, obviously you don't want it full of chemicals or sprayed, but cannabis alone is not harmful. It's just the way the black market is run. That's why people feel more safer now. We can access it without going down the road and standing near a car park. It's so much more. Yeah, it's a lot. Like one of my mates, he's so much more happier that he used to be a black market. He used to be on a black market all the time, and he's constantly ringing this bloke, ringing that bloke, and now he's like, Ed, I can't believe it, mate. I'm so happy that you put me onto him. He goes, now I don't even have to worry. And he goes, he's a fireman actually.
Yeah, but amazing. Well, he needs to be safe then, doesn't he? I mean, that's a job where you don't want to be. There's a very serious consequences involved as to how he does his job. And, if he gets blamed for something and it turns out he's got illegal drugs in his body, he's going to get in a lot of trouble. So, people don't really, I think there's a bigger picture to it. I guess, firstly, what are you getting for your money? You might spend more, but you get access to a clinic. You can talk to a nurse or a doctor or a clinic manager, someone who can talk to you about your medication, who can support you with any dispute, perhaps with your employer or your driving license. They can write a letter for you so you can travel with your meds on abroad. There's a lot more they can do for you. Yes, you're paying a little bit for it, but what you're actually getting from a lot of those clinics, and I'll get accused of that bias of being like, well, you work for them, of course you're going to justify it, but it is a good value for money. What you're getting is actually it's incredibly good value for money from the clinics in terms of, if you were to pay a non-cannabis private clinic to get that same level of care, it'd be hundreds and hundreds of pounds more than what you're getting through a cannabis clinic. I often say to people who are, if I come across someone and they're not interested in cannabis at all, but they need to see a pain specialist or a private pain specialist, I'm like, actually, the cheapest way to see a private pain specialist in the UK is to go to one of these cannabis clinics. Don't go to a private pain clinic. Go to a cannabis clinic, because yes, they'll be interested in, they'll have an intention to talk about cannabis, but they're a pain doctor. And they will have a conversation with you about gabapentin or physiotherapy or whatever. They're trained. They know what they're talking about. And whilst they might say, oh, I have a physiotherapist, but you need to go to this other clinic and ask me there for them, or you need to go back to your GP and get it there. You might not get what you need in that moment, in that call, but you'll get to talk to a pain specialist for pennies, what you compared to what you would if you went to privately. It's we're in such a unique position in the UK because of the NHS, where people don't pay for medicine, and no one knows what it's worth. No one knows how much it costs to deliver.
Yeah.
And it's expensive. It's expensive because a lot of red tape. It's expensive because a lot of standards. It's expensive because you're paying doctors who themselves have had to do 7+ years of a degree and have debts to pay. There's a whole world in medicine of understanding and learning about that I've learned since joining Grow. Beforehand, I would have been in agreement with a lot of the stuff I hear now that makes me cringe and makes me think, oh, you don't know what you're talking about, from patients, from the sort of the critics of the industry. But when you understand healthcare and how complicated it is and how much responsibility there is and how much licenses cost for things, it's we have an incredibly good system, considering. It is my honest opinion. Honestly, is it great if it's cheaper. The NHS access, we need to move things forward, but and it's taken some time. Like you say, COVID helped with the digitizing of consultations like we're having now, and a few other changes to the rules that enabled us to make things a bit more streamlined. But really, a lot of these misconceptions are a big part of our problem. The reason it's not good is because people keep on going on about it being not good. I think there's a desire to not want to buy into it because it is corporate, because it is not about the culture, it's not about the subculture and the community. And I think that's where that tension is. So what you have with people who've used cannabis legally, the people who've made it part of their identity specifically. Again, I was one of those. Not a criticism. So I became someone who was very involved in the cannabis community and committed to understanding a lot of that and being a big part of that. And obviously this medical world takes away from that in a lot of ways, because whilst it was illegal, the cannabis community and the subculture was a haven, and still is a haven, for people who are into cannabis, because the rest of the world is stigmatizing against you for what you enjoy or what you benefit from as a medicine, and that's very isolating. So you go out, you go online, you find the people who are into what you're into, like everybody else does. It's just in this community, you're into something that's either illegal or has the perception of something that's illegal, or the stigma of something that was illegal. And so it becomes a big part of your life, and that community feels like a place that's safe, feels like a place that is like-minded and cares for you and does that. And I don't know if it always does. And I get to see the bad side when that doesn't work out a lot of the time. A lot of patients who have a bad experience of the subculture or the community often come to me and talk to me about that. And it can be quite upsetting and it can be quite problematic generally. But also it does a lot of great work, that community, especially before it was legal. That's where people got their information about cannabis and how to use it. It wasn't from doctors, because there were no doctors to talk to. It was from the best patients, that the most experienced people out there, putting themselves on the line a bit and making themselves publicly, saying, "Hi, here we're cannabis users and we can tell you about this." And so I get it. I guess what my point is, I get from the community's point of view why it feels like the soul of what you did is being taken away. But the reality is that responsibility of providing medical education and support has gone to the medical professionals, which is where it should have been all along. And I suppose the other caveat is, the other part of this is, if it was decriminalized, this wouldn't be such a problem, and that stigma would start to fade away, and the community wouldn't be so important, because you'd be accepted in wider society. And if we had cafes like in Amsterdam, no one would feel they had to hide, and there wouldn't be this resentment and all of this emotion that's built up into this, the community sort of identifies as fighting against all of this commotion, all of this stigma. So I get it. It's really difficult to work for a medical company whilst we still don't have, while it's still criminalized generally. I've just started on TikTok, and I did a whole video the other day and then deleted it because I didn't like it. And I didn't think it was more me. It was like, I don't like it because I'm sort of trying to justify things, and I don't ever want to justify things. If I'm justifying things, I think that's because I've internalized some shame or something, and I need to deal. So it's not about me putting out TikTok. That's actually, I need to do some thinking about myself. But essentially what it was is, why am I not still campaigning? for decrim or for rec or for, you know, for,
Yeah.
because it's important. I do really believe it's important. I believe in decriminalization of all drugs. Criminalizing people for using drugs is nonsense. Locking people up for possession of cannabis is nonsense. Locking people up for growing something at home that they intend to consume themselves is nonsense.
Crazy,
Yeah, and, you know, and I'm in a beautiful position of being able to work for a pharma company, and I can come on this and say that. And I'm not, you know, I know my boss will be like, "Oh, Alex, you're on your soapbox again," but he'll roll his eyes at worst. He won't be upset with me saying that, because that's the beauty of being in the cannabis space, is we're like a corporate part of the world that is actually very open-minded, because we had to be, because we're dealing with this world of medical cannabis. So
exactly, yeah,
you get, and I guess the answer to the question, the justification, is if I'm going to film it and put it on the internet with you, I'm going to do it eventually anyway, is that actually there's a lot of work to be done on the medical side that I really do think is important. I really do believe in. And then I'm suppose best placed to be doing that. Like, it's not that I couldn't do campaigning, but my specialism, I've niched into this medical understanding of this, and supporting patients and providing awareness of prescriptions is what I do best.
Yeah.
And it's not that I suppose I'll never do any more campaigning, but that there's so much work left to be done on the prescription side of things. There's so many more doctors who need to understand this. There's so much stigma still, people with prescriptions dealing with all sorts of nonsense from the police, employers, your venue owners, also all over the place.
Yeah.
And then there's NHS access, there's clinical trials, there's the long game of
that's a big one, isn't it?
Oh, it's huge.
That's a big one, that is. I mean, I'm not gonna lie, in January I couldn't afford my medicine. I couldn't afford it because it's Christmas, and I couldn't for the month of January. I was unable to. I mean, it's not that I don't want to go out and work. I'm a carer for my wife. She's got lupus, Crohn's, arthritis, osteopenia. You know, I've quite a few things. So I'm a full-time carer for her. So I can't just go out and get money like everyone else. You know, so it's quite difficult. But with the NHS, if they just open up, we'd be out. It wouldn't. I wouldn't. You're not going to abuse it. You know, you just. I mean, obviously, people will. Like I say before, people's always going to abuse something. But in my eyes, I believe that I've saved them so much money.
Yeah, that argument is powerful. The cost analysis one, I hope people do more. I guess the issue with the NHS is the clinical trials are so expensive. What they expect in terms of clinical data costs tens of millions of pounds.
Yeah.
It's not that pharma companies like Grow don't want to do that work. It's that we couldn't afford to if we wanted to. We are just not that scale of pharma company. Again, something I know my employers are more than happy for me to say, we are not at that point yet, because we know in the UK there's 35,000 maybe patients. That's the revenue as a total industry from 35,000 patients isn't going to pay for clinical trials. Probably wouldn't pay for one. It's, you know, there just wouldn't be that spare revenue at the, you know, the prices we're doing, at the revenue we're making. So, and then you need a big pharma. So there are clinical trials happening. Pfizer is doing a clinical trial. Sorry?
Is it GW or is it called something else now? I'm not too
GW
sure.
got bought by Jazz. So GW are the only company that GW get a lot of slack for being the most big pharma, I suppose, in the cannabis world.
They've got a lot of money. Couldn't they do something?
Do. You know? Well, they have, and they have, and they did, and they will continue to. They are doing trials. I believe they're still doing trials. So GW, for those who don't know, big pharma company, UK based, really pioneers, and do need to get some credit for being pioneers in this space, because they were doing clinical trials in cannabis way before it was generally accepted as a medicine in this country. So the highest possible cost of a clinical trial, very strict regulations, and a lot of balls to do that and put that level of money behind that, because they didn't know what the outcome was going to be. I think, you know, you and I know there's medical value to it as consumers, but so then there's another question. You start to put tens, not even hundreds of millions of pounds into these trials. And they did succeed. They licensed 2 medicines. They licensed Sativex, which has THC in it, and Epidiolex, which does not, it's just CBD. And both of those are available on the NHS. So I think people are like, oh, it needs to be on the NHS. Well, it is, first and foremost. That can be done. That's what I'm saying. I'm not saying it shouldn't be. But the problem we have with the NHS is you license one by one. So you get a medicine, a specific drug for a specific condition, you prove that it works, and then you license it. So Sativex is only available for people with MS because of their spasticity. Epidiolex is for people with certain epilepsies, for seizure control. And if you wanted to just get that Sativex prescribed for pain, here you can even do something called off-license prescribing, and technically that can be done. But if you wanted to make it generally available and reimbursed for people with pain,
Yeah.
you would have to do a whole nother clinical trial
With the same product.
the same product from the
Yeah.
start. Another 10 to 100 mil. It's insane. It's so expensive, and it's years. It takes years to do it. That's why it's so expensive, so difficult. And that's where we are with cannabis. And I guess the reassuring part I want to say is, look, it's going to take a long time before anyone's doing that with flower.
Yeah.
Although there are people talking about it. There was the campaign trial, which they did the feasibility, and now we're waiting for them to do the full trial. But there's also big pharma companies are doing this work in the background quietly. Pfizer have a trial for Crohn's disease.
Really?
Yep, that is ongoing. No results as yet, but they're doing it with, I believe it's an isolated form of THC. I can't remember if it's a synthetic cannabinoid, but they're looking at this at that very pharma geeky level of, well, let's get the exact compound right, and then we'll do this thing. And then so it's not going to be like flowers or cartridges or anything that we're used to. But
they're not making Delta 8 in there, are they?
I mean, it could, for all I know. It probably isn't. No, but
yeah.
But in theory, they could be. They absolutely could be. It's just a compound. The fact it has psychoactive effects will influence whether they feel, well, side effects basically for them. And then, so I mean, and there's who else? So GW were bought by Jazz, but I know they were in the process of doing trials for tumors, I think in children. So I think it was a glioblastoma trial in children that was ongoing, that is ongoing. There's others as well. I can't think what the company's called, but there's another big, I think they're Canadian company that are, or more like a pharma cannabis company that are not unlike GW. But so that, I mean, that's the other thing, that work is happening, but it's not the companies that are doing the private delivery of the private medicine that are doing, they're sort of a completely different scale of pharma company. The companies delivering the private medicine are dealing with an unlicensed drug. They're cannabis specialists. They're quite small companies. This is like grow basically. This is not. We're not big pharma, I think, is the kind of the point I'm making. I suppose the underlying, and also the big pharma are doing the work that we know needs to be done. So there's an element of just the way the world works. Big pharma.
And we all just get along.
Yeah, exactly. Right. There's value in all this. We don't need these, the conspiracy theories about Theresa May and GW, which is all nonsense. I mean, it's not nonsense, but it's making mountains out of nothing. There's a lot that we talk about in the community that holds us back because we're not really being realistic about the world we live in. And I said it on another podcast, and I'll say it again, because people were commenting saying, that's a really good point, which was we should be advocating for or campaigning within the world that we live in, not trying to campaign for something that we want. That sort of desire-based campaigning is you've got to think about what's going to work and what's best, and what the overall, what we want is access and better access and cheaper access and reimbursed NHS access.
Yeah.
Okay, yes, we need to know that and establish that, but then you have to take all of that and make that fit into the world we live in.
To get there,
to
get there where you want to get, you've got to deal with what's going on at the moment, aren't you?
Exactly.
Yeah.
Exactly. And I think a lot of people who are into cannabis and would like the laws to change are also upset at the general state of the world, and I understand that. Late stage capitalism, global warming, etc.
Yeah.
That's before we go into anything about what's going on politically at the moment, which frankly let's just say it's awful and move on. I suppose if we're going to say anything, it's that thoughts going out to Gaza and all that stuff, but without wanting to get too stuck into that, it's a fucking horrible world at the moment. Sorry, I shouldn't be. You have to bleep me. Slap me on the wrist. Yes. And I get why people are so frustrated, and I get why capitalism isn't a wonderful thing always, and especially when it's something you love and you care about, this cannabis world and this community and this subculture, and you don't want big corporations to come in and tread on it and stamp on it. The reality is they're going to come in, whether they stamp on it and make a mess of it, that's depends on the company and the people involved, but they're going to turn up and they're going to do it one way or another. And the more that we engage with it, the people that care about this, and this is, I suppose, what I've done, is I've gone, right, I don't know if this is going to be a fantastic thing in the long term, this industry. I believe it will now. I know it better. But when I started, I didn't know what prescription cannabis was going to look like. But we need people who care as much as I do inside. And, if you're watching this and you're someone who cares about cannabis, we need you in the inside. We need you to understand the world of pharmaceuticals. If medical is your thing, we need, if you want to campaign for legalization or decriminalization, you need to understand politics, and that means talking to conservatives and UKIP and whoever. Like, you need to have to be able to engage with every single person in that, understand their motives, and essentially manipulate that system to get what you want. And if you don't have the patience or the time or the empathy to be able to talk with conservative politicians, for example, which I think is a big hurdle for a lot of people in the cannabis space. Some of them are really lovely people. They really are. Some of them aren't. But I think that's true across all parties. Anyway, get away from politics again. But like, we have to deal with the world as it is, and you have to be able to put your own feelings aside and try and tug this big lumbering thing into a direction that makes sense. Or I suppose you could suggest that there's a limit in how much you can even pull this big, corporate world into the direction you want. But you can certainly, it's like a rushing river flowing, and you can get into that stream, and you can help keep people alive and keep people afloat amongst that thing, I suppose, as well. This sounds more desperate now, doesn't it? But it's sounds
I
terrible.
understand you, mate.
But you get what I'm saying. You sort of have to accept the world for all its faults and try and do your best. And if you can't, if you're going to sit behind a screen and get angry and type away on social media, it's a means to an end, but it's not a means to change. It's a means to making you feel better. And if you need to feel better, fine. But I understand. But if it's a community, I think there's a level of growing up that we need to do. And I think it's interesting because I talked to some of the people who were most against the pharma side of things 2 or 3 years ago. And I think they're coming to terms with this too. And they're realizing that we have to do this. Yeah,
I was against medical cannabis. Basically, I wanted it.
Well, there we go.
I'm being honest. Because when it came in, like I said, it was so expensive, and I was like, this is just money grabbing. That's all. You know that you've heard it before, haven't you? You've heard the comments, read the comments, and once I gave in, I feel like I was like, I'm giving in. I'm going to do it. And he was like, oh wow, it's actually. My whole perception changed of the whole industry, if you like, because it felt like I was on you're coming in and taking everything away from us. But then when you actually get involved and you talk to the clinics and the people at the clinics as well, they're nice people. They're not there just like, give me the money. It's not like that. You know what I mean? Yeah, there are good clinics and there are not so good clinics, but that's the same with doctors and GPs. My wife went through many GPs before she got her diagnosis. Some of them you're just depressed. You think, come on. But yeah, no, I was against it. But no, that's why I started the channel. I want to let people know that actually it's all right, mate. it's all right. It's not like me just saying, oh yeah, I've gone over to the dark side. No. It's actually it's not that bad over here, mate.
It's all the same side. It is all the same side. That's the other. I say over and over again. Like we're all pro cannabis. It's the pro cannabis versus the anti cannabis. That's the war. That's the battle. Like there's no other sides.
Like the rec and the medical. It seems like there's been a little bit of a. They need to come back. We need to mesh back together again, because I'm not going to lie to you. I'm going to Holland this year in August. And I'm going to be recreationally using cannabis.
Yeah, fair play to you. Why wouldn't you?
And I don't drink alcohol and I don't do drugs. I haven't done coke or drunk alcohol for over 11 years now. I had a bit of a problem with it, So my advice would be, if I go out to a party, I'll have a bit recreationally. But if I'm in pain and I'm at home and I need to do the washing up, I'll use it for my medicinal purposes,
Mm-hmm.
So yeah.
This is it.
Yeah, I wanted to ask you one more thing.
Yeah, sure, go ahead.
Clarify driving for us.
Yeah, okay, yeah, I'll do that real quick. That is a really important one, and something that we're working on to get more of this information out by the clinics and pharmacies, because it is, I think, one where patients need to be empowered by the correct information. So you should not drive if you are at all impaired. You are the person who decides if you're impaired, but you should definitely be honest with yourself. In terms of, if you don't feel like, if there's any chance that you don't feel capable of driving, you should not get behind the wheel. And that's true of any controlled drug, any prescription controlled drug, right? The thing to know, I suppose, is that the police in the UK are not always clued up about prescription cannabis. They're not always aware it exists. And sometimes they'll make the assumption that you've been consuming recreational cannabis And even it's sometimes, rarely, but even if you show them a prescription, they might still think it's a scam. It's not a real thing. You've made up some paperwork, all of this stuff. So the thing to be aware of, and the thing you need to do as a patient, if you're stopped at the side of the road by police, and you're providing there's nothing else you've done wrong, let's go, which will complicate things. But let's say you have a tail light out or whatever, all innocent and above board, and you're stopped at the road, and someone says, "Oh, I can smell cannabis. I'm going to swab you." Do not refuse the swab.
Oh, really?
Do not refuse. Refusing a swab is a different charge, and if you refuse a swab, you are then guilty for refusing a swab, and you will be guilty of something. So you potentially will get a criminal record just for refusing a swab. So
you just tell them, no, I'm going to fail this swab.
Yeah, that's the next part. So the next part is and before you take the swab, you should inform them. You should say, look, I am prescribed a CBPM, which is a cannabis-based prescription medicine. And you could say it's medical cannabis, it's cannabis medicine, but CBPM is the official word for all of these unlicensed cannabis medicines. Here's my prescription. Here's my clinic. Here's the contact details for the clinic and the pharmacy. You can contact them and confirm that this is a legal prescription if there's any doubt. And the really important part is that you need to say, look, I am covered under Section 5A, Part 3.
Yes.
5A, Part 3. That memorized. Everyone who's got a prescription and drives. I don't have a license, but I've memorized this. Section 5A, Part 3, which is your medical defense, which means if you're prescribed a drug and you're taking it in accordance with the doctor's, there we go, you're taking notes. If you're prescribed a drug, you've taken a drug and you're prescribed it, you're taking the drug in accordance with the prescribed notes. So if you're vaporizing your flower, basically, you're doing everything as the doctor's told you to do, you're using it as much as you're supposed to be doing, you have a medical defense in law for having THC in your system. And providing you say that, providing you take the swab, you will of course test positive for the swab. They may want to take you to the station. They may want to take bloods. They may do all of this extra work. But if you say that, you will be covered in law. You will not lose your license. You will not get a criminal record for having THC in your body. Whether you were involved in other complications, I can't make any promises, but I've yet to see anybody being prosecuted for that.
This THC per litre of blood that they have.
Yeah.
Now, this isn't quite correct, is it? Because cannabis stays in your body longer.
Well, yes, it doesn't mean anything. I think, the cynic in me says they put that limit very, very, very low to catch out people who consume cannabis generally. And you're quite right, that if you test positive, it doesn't mean that you're inebriated. And those two things aren't necessarily connected. The important thing to understand is that if you have a prescription, that Section 5 thing, that means that limit does not apply to you. Because you are prescribed it, you have it in your body because the doctor says you should have it in your body. Not because you've decided to take an illegal drug, but because the doctor has said, here's a prescription for you, you should be taking this, and providing you're taking it in the doctor's orders, it's that difference between self-medication and just medication. Self-medication is you've made a decision, and it's for something that's illegal, and we don't really know what's in it, and then you decide to get behind the wheel. And whether that happened 2 days ago or not, there's a disparity, like you say, but with the prescribed medication, you don't make any decisions at all. You have to drive because you live, and your doctor says this is the medication for you. So it's not you're not the person who's even made the decision to have it in your body. That's the doctor said that's okay. So again, you're sort of diverting to an authority that can override that, and that part of that law is how that works. It lays out
5A Part 3, yeah?
Correct. Yes. Yeah.
Right. Remember that, people. Remember that.
Yeah. And that's of the road traffic. They'll know it's the RTA, but the Road Traffic Act. I believe it's 1988. It's an old piece of legislation. Section 5A Part 3. Yeah, I'm gonna say it so many times, but it's really worth having that, and having that written down somewhere in your car, because you won't necessarily be able to bring it to mind when you're stopped by the police and you're sweating because you don't know what's going on, or you're just nervous.
Well, I have a little bag. I have my vaporizer. I have my medical cannabis, and I also have my prescription from the clinic, and I will now have that as well along with that. So if I ever get pulled up, that's what I'll be showing them. Yeah, so,
exactly that.
Right, before we leave, I know you've got to shoot off soon. Did you want to tell everyone about your YouTube channel and your Facebook page, where they can find you?
Yeah, no, that would be great. Yes. Oh God, there's so many places.
I'll leave if you send me the links.
I will send you a link. But yeah, look, I mean, the Facebook page is the Medical Cannabis Forum UK. I think it's a private group. I think it might be hidden, so it's not always the easiest thing to find, but it is there. You can always send me a message on my socials. I'm Alex Fraser. You'll be able to see my face on my profile picture on Facebook. I'm on Instagram. I'm on TikTok now as well. I'll put like a link tree thing so you can get them all via there. Grow Conversations is the YouTube channel, so that's in collaboration with Grow, and that's me sort of interviewing the people who work in the industry, basically giving you guys a window into that world and the brightest, most wonderful people within it. So I just interviewed Nurse James from Integro, who's an absolutely fantastic nurse. And that interview's, people have been very responsive to that because he's just such a fantastic human being.
He seems like a nice guy, doesn't he?
He's a legend. He's such a nice guy. There are some real stars in this industry. It's worth getting involved. Like I say, to all of those who are skeptical, to all of those who worry about the corporatization of cannabis and all of that stuff, I think, get involved and speak to the people and make it the industry that you want it to be, rather than fighting it. I think because I don't think it's going anywhere, unfortunately.
No.
Certainly doing everything I can to proliferate it and make it bigger and better for patients. So that's a good place to end.
That's wonderful, mate. And so, thank you for coming and spending your time with us and sharing your. It's been quite. I've only answered you a couple of questions, but we'd have carried on talking. It's great.
I will do that. I will just keep talking. Yeah, see, I've done quite a few of these, and I know what you want.
Perfect. That's exactly what we want.
It's all true. It's all the truth. It's all the life I've lived. So, and thank you for giving me a chance to tell that story. I'm usually the person asking the questions, so it's a pleasure to get to talk about myself a bit.
Well, you're the first person I've interviewed on the channel, anyway. So
wow.
Hopefully, come. Thank you, sir. Yeah. So. Thank you very much, Alex, and thank you everyone for watching. Like and subscribe. Go over to Alex. Go to his YouTube channel. Give him some love. Come on, people. Anyway, peace out. If no one said it to you today, people, I'm going to say it to you, all right? I love you. Peace out.
Love you guys. Thanks, Ed.
Lovely. All right, mate. So, happy day.